Hello and welcome back to KXAN Plus. I'm your host, Esmeralda Zamora, and today we have our Simple Health segment with our KXAN Simple Health expert, Jose Torres. Jose, how are you doing today?
I'm doing great, Esme. How are you?
I'm doing good. It's getting colder, so it feels great, but it's always cold all year round here in the studio, so we're used to it.
You know about the cold weather, what's perfect about it?
What's perfect about it?
It makes running even better.
I've heard and I've tried recently, and it does feel a little bit better.
Better than the hot melting sun.
For sure. I'm not trying to run back to my house as fast as I can when I go running. Before we get started into a topic that is very important right now, give us a rundown of what Simple Health is and why we cover it here at KXAN.
Okay. Well, here at KXAN Simple Health, we want to just help empower you with information that sometimes may feel complicated or overwhelming. And so, whether that is talking about Medicare enrollment or new research that may be too hard to digest, we want to talk about that and go over it and let you know what's going on, and also about the awesome resources that the Austin medical community has here in Central Texas. We talked about new HIV treatments. We've talked about new NICU units and how it's helped families. And so we try to also bring you that personal storyline as well, just to help connect with viewers and personalize those stories, just to help understand the need as well.
And of course, today is just another day where we're breaking things down. One topic that we are covering is open enrollment for Medicare, which has already started, I believe.
Yes.
And we have a special guest here to help us talk all about it. Jose, what are we going to cover today?
Well, I'm my mom's caregiver, and whenever it came to her time to enroll, I made a mistake, and it was a costly mistake. And
Wow.
so hopefully this program will help people avoid doing things like that.
Yes.
So we want to make it easy for everyone, and there are certain things just to let you know here before we get started. People who are eligible are 65 and older, people with disabilities, and there's also other specific medical conditions that sometimes
Can make you eligible, right?
yeah. And so also, when you are 3 months away from your 65th birthday, you are eligible to sign up. All right. With us today is Carol. She is an insurance agent specializing in Medicare coverage. Carol, thank you so much for joining us.
Thanks for being here.
Well, thanks for having me. I'm excited to talk about what my passion is Medicare.
Well, let's get straight to it. There are 4 parts to Medicare. Help us understand what those 4 parts are.
We have, as you see on the screen, Part A is hospital insurance. And when I say hospital insurance, it is not just the hospital. There are a few other things that go with Part A, and we're going to talk about those in a minute. Part B is all about your medical, and that includes a lot of your equipment, your doctors, and other items that you need on the medical side. And Part C is where they have combined the Part A, Part B, and Part D. And we know it as Medicare Advantage plans. Part C, it was called Choice, Medicare Choice at one time. But the Part D is your prescription drug, Part D for drugs. So that's the easy way to remember the alphabet soup that we call Medicare, A, B, C, and D.
And Carol, is every individual required to sign up for each one of these parts?
No. And when we get to the mistakes made, I'm going to talk a little bit about that, why and when you need to sign up for Medicare, and if you need Medicare, so like if you're working. So we're going to dive into those details and things to avoid penalties here shortly.
Well, let's dive into that first one. I'm going to bring that up a little bigger for us to see, and that's Part A, hospital insurance.
So the hospital insurance is not always free. It is premium free for most people in this country that you've either worked 40 quarters, it's 10 years, if you have someone come into the country and maybe hasn't been able to work all that time, they can buy into Part A. But most every of people that are working in the country get that premium free. So if you look at it, and the easy way to remember it is hospital, hospice, home care, or skilled care. And that's covered. You think of these big buildings we go in, and that's usually covered under Part A of your Medicare. And most people think of hospitals.
So anytime you're going in person to get some sort of treatment or care, that would fall under Part A?
Inpatient hospital stays. And stays is important because you can go in for day surgery, but that actually falls under Part B. So inpatient hospital stays is when you're in overnight.
So is there like a time frame that falls under this category? Is it just a few hours, or does it have to be a full 24-hour
There have been
stay?
some legislation to keep bad actors from putting a person in the hospital for 23 hours, not 24, and then they get charged an astronomical fee. And we put a stop to that at the legislative level in the past few years. And one of the things I'd like to say about hospice care in the Part A of Medicare, everybody is eligible for hospice care that has A, and there is no charge ever for hospice care, whether you have a Medicare Advantage or you have original Medicare A and B. So that's very important to know that hospice is never a charge, that we take care of those people getting towards the end of their life.
Behavior and mental health. What do you know about that specific coverage?
That covers under the behavioral health side if you have a hospital. And many of these come under Part A because it is considered a hospital setting. So you're going in as inpatient in a mental hospital. Again, doctor's visits, mental health specialists come under B, but a mental health facility can be covered under Part A.
And what about the skilled nursing facilities?
Skilled nursing has certain levels of care. When we think about Medicare paying for the skilled facilities, that's in a rehabilitation setting. So it's not really going in for, we think of people that just can't do the activities of daily living, like getting out of bed or transferring to the toilet or eating or taking meds. But skilled nursing coverage by a health insurance, Part A, is for rehabilitation. So you have to be getting better. And if you plateau, that's when Medicare A stops paying, and then you're on private pay.
Interesting. So those are the four parts, or I'm sorry, those are the categories under Part A, but there is also a Part B, and Part B is medical insurance.
That's right. B. I like to say it's B basically for everything else. A is, think A as hospital, things like that. B is basically everything else. You've got your medical equipment, your durable medical equipment. You've got your doctor's visits. You've got your day surgeries. So if you go into a day surgery, something like cataract surgery, or in my case, my knee replacement was done as day surgery. So that comes under just a little bit of A, but a whole lot of B. So if you think of your Part B as your doctor's visits, anytime you go in for a clinic, a test, a lab, those are all the things that come under B, all the medical side.
I think I have the wrong graphic up. Let me fix that before we move on so we know exactly what we're talking about. And what about, here, let me pull that up first.
Because we think of B as
go.
all things that you do on a day-to-day basis. Many of us don't ever go into the hospital. Even as we get older, hospital stays are rare. But your Part B does have a monthly premium. Now, your monthly premium, we have a little asterisk by that because your monthly premium it starts this year at $185, and it can go higher. There's a number of levels, and it's called an IRMA charge, income-related monthly adjusted amount. It took me a long time to memorize that. But IRMA is for those high-income earners that they have a different premium. Preventative services are now covered in Medicare, but if we were talking in 2012, before the Affordable Care Act, Medicare did not have any preventative services. You paid for everything, and it's a fee-for-service model. So the Affordable Care Act, with the many other things that it brought to the table, it brought preventative services into Medicare. So if you have a preventative colonoscopy, you have skin checks, you have pap smears and mammograms, those are under preventative services, and there's no charge to the customer for these types of services. Ambulances, medical equipment, again, A is hospital, B is basically everything else that you can think of that we use B for.
And medical equipment, that's like wheelchairs. What's another example?
Your crutches,
Okay.
CPAP machines, diabetic supplies. some of the durable, well, diabetic supplies is kind of this whole category. We won't go into that at the moment. But any hospital beds, things, the hospital beds, special chairs, lifts, bath chairs, things like that can come under the DME or durable medical equipment.
Oh,
So
that's good to know. We also have Part C, and Part C, I'm trying to remember here. Don't tell me.
Don't look at the screen.
Medicare Advantage plans, and there's a lot of plans.
yes, there are. And this is probably the most confusing part.
Yeah.
Do I choose to use A and B? Do I choose to enroll in a Medicare Advantage? And there are advantages. Yes, that pun is intended. There are advantages to the Medicare Advantage because what they've done is they have combined, like I said, they have combined A, B, and D. So a Medicare Advantage plan can have no less. It cannot have any less than what A and B of Medicare have. So it has to have everything. The key is how it's administered, where it's administered, and how you pay for it. So when you're in a Medicare Advantage plan, you can choose an HMO or a PPO health plan. There's another one not as well known, but it's PFFS. It's a private fee for service. It is a type of Medicare plan. We have some in the outlying areas of Central Texas. It's usually used when you're in a more rural area because you have a little bit different type of network. But HMOs have a network, PPOs have a network, and they're all offered by private companies, and you'll recognize some of the names you don't recognize. I usually encourage people to stay with the recognized names because those doctor networks are usually very well put together. They're very well thought out. And if you're in an urban area, it's usually much easier. If you're in an outlying rural area, it becomes tricky, and you have to pay a lot of attention to what hospital system, Baylor Scott and White, Memorial Hermann. Some plans are in certain hospital systems, and now that we have hospital mergers, again, you have to be very cognizant of networks in these plans. But they do add vision, dental, hearing that original Medicare does not offer. We don't have any dental with a original Medicare A and B. You also get health and wellness benefits.
What does that mean, health and wellness?
Oh, that's a great one because all of my clients, not all of them, I wish all of them, all of you clients, listen. The plans offer, they call it the wellness benefit. You can, one of them is Silver Sneakers. There's one called Renew Active.
I've heard of that one before.
And those are, you get an all-access pass to many of the premier gyms. Gold's 24 hours in this area, Planet Fitness.
24-hour fitness.
24-hour fitness, right. And you get into that. You can go to a spin class in the morning. You can go to a swim class in the afternoons at another gym. It's not just one membership. So these plans, the whole kind of shift in these plans is to keep you healthy. Again, the advantages are there to keep you healthy because a private company is in charge of paying for all of your benefits. And Medicare does give money to these private companies to take care of all the beneficiaries. So they want to keep you healthy. They don't force you to go, and they don't force you to be enrolled in these programs like some employers can. But these are all optional. But it's to keep all of us in better health.
That's a really awesome plan because you can keep moving and have this access to gyms.
And if you are not mobile, they will often send equipment. They will often try to make it accessible to you. You can do classes at home. There's videos. There's exercise workout.
Oh, cool.
They will often give you the opportunity to purchase at a discount the bands and different things that you can do. Chair yoga is one. I think of chair yoga all the time because you can be totally sedentary and still be able to move your limbs so that you don't get so stiff.
Yeah, I think we did a story on chair yoga, Jose, and we were kind of talking about the benefits. We also were doing a story on granny basketball. That one was really interesting. Yeah. And I'm sure these gyms offer equipment or spaces to do stuff like that too.
They do. They have Silver Sneaker classes.
Oh.
Renew Active and Silver Sneakers, they're so similar. But yeah, you can look up silversneakers.com or renewactive.com if that's a benefit on your plan. In some areas of the country, you can buy into it, but most areas of the country, it has to be a benefit on the plan. And most of the Central Texas plans have those fitness benefits and wellness benefits.
And how can someone go and search to see if their plan has that benefit?
On the one we just looked it up, on the Silver Sneakers, they actually will see if you're eligible. So you put your name and you put your date of birth, and I think they may ask for your plan, but they will check your eligibility. And you can also then call your insurance company to see if it's a benefit. And all of these plans, we're still talking about the Medicare Advantage plans, they have what we call a summary of benefits. And on each of those HMOs and PPOs, they have the document that is, it's got a summary, but then there is a huge document, about 300-page PDF, but it's the evidence of coverage, all the details. If you call customer service, they're looking at that evidence of coverage. They're going to answer your question based on that. So it's all detailed in there, but most of us just want the summary of benefits. We want to see a summary of what our benefits are, and that's listed on there, whether you have the wellness and what wellness benefits you have. Some offer transportation, and that's very important for many people to have transportation, because as many of us age, we may not drive as far or as well. I did have a client tell me today she doesn't drive more than 10 miles because it exhausts her. With the type of illness she has, it's too exhausting to drive much farther than that. So if she has to go see a specialist across town, she really needs a plan that offers transportation. And some of them do.
Wow.
And that was all under our Plan C. We also have D here, and that one covers prescription drug coverage, like you mentioned earlier, D for drugs.
That's right. That's how I remember it. This is this came into existence in 2011. So if I were talking to, not 2011, that was the Affordable Care Act. It was 2006. And 2006 was when the Medicare Modernization Act came in. And before that, if I was having a conversation with you, I would not be able to offer you a Part D drug plan. If you came off an employer plan, Medicare just had A and B. That's all they had. So the Part D plan was a phenomenal addition to the program, and it's changed a lot. And one of the latest pieces of legislation came in the last administration from the Inflation Reduction Act, and it's huge for those people that are on a lot of cancer drugs, on anti-rejection drugs, and different very expensive medications, the weight loss medications for diabetics. Okay, you cannot, Medicare does not cover drugs for weight loss if there is not a condition with it, such as diabetes. Medicare doesn't cover any cosmetic type drugs, compounds. So there are certain medications that are on these plans, but no beneficiary can be more than $2,000 out of pocket in a given year. But there is a new vocabulary word for us today. It's called formulary. Formulary is nothing to do with the racetrack. It is a list of drugs. And each plan, each year, puts a list of drugs, and they have to put all these plans before Medicare, before CMS, the Centers for Medicare and Medicaid Services. And if your drug is not on that formulary, it's not covered. So you have to pay full for it. So it doesn't count towards that $2,000 out of pocket. So we have to be very careful during this enrollment period, every year from October 15th to December 7th, if you have a Medicare Advantage or a Part D drug plan, but especially if you have a standalone Part D drug plan, you need to check. And that if you're taking a medication and it goes off the formulary, then you would pay cash, full price for that medication for the whole next year. And so I recommend to people the best way to check your Part D plan is through Medicare.gov. It's www.medicare.gov. All of the medications that one takes and purchases with that card, not the RX, Good RX, or any HEB coupon or Walgreens coupon. If you purchase the medication with your Part D prescription plan card, it is automatically fed into the Medicare.gov database. So if I were to go in with you sitting side by side, I would look into your Medicare.gov and I would see that all your medications listed, and then it's going to spit out the very best plan. Shouldn't say spit out. It's going to tell you and recommend to you the next plan, but it's also going to tell you, like if your current plan doesn't have a medication that's $1,000 a month, it will also tell you your medications are going to cost over $12,000 next year for the current plan. But the next plan will be $3,000 or, not more than $2,000. And it will show you which ones.
Interesting. That's a lot of information for all those plans. Jose, did you have a question?
Yeah, something I forgot to make a graphic for is Medigap. And that sometimes it confused me in the beginning when I was...
What is it called?
Medigap.
Medigap.
And so, correct me if I'm wrong, that is a gap of coverage that you're trying to cover, right?
Mm-hmm. Because Medicare, A, covers hospitals after a deductible, around $1,600. Depends on the year. Okay, we're now turning over to a new year, to 2026. So every year that changes, but you have that deductible every time you go into the hospital. Not just a yearly deductible, it's a deductible every time. And then Part B of Medicare it's only an 80%, 20% coverage. So Medicare pays 80% after one smaller deductible. This year it's $256, but it's 80/20. So if you have a $1,000 event at a facility, you're going to owe the $200. If you have a $100,000 heart attack, you're going to owe $20,000. So the Medigap or Medicare supplement, we laugh when we call it Medigap. Medicare slapped our hands back in the day when we used that term Medigap, but now they actually use it on their site because it's much simpler than saying a Medicare supplemental plan. And that's where you hear more alphabet soup, the N, G, F, and those are plans. We have parts of Medicare, and then we have plans. So our Medicare plans, and the most popular, are the F for the older, those that were 65 before 2020, and there's no more Plan Fs offered. Now it's Plan G and Plan N and K and L, and there's some others, but there are. It's a benefit grid, and that's all set by the government. So not everybody has to offer the same benefit grid. Plan G is one deductible, and then you pay a premium to the private company, and then it covers all of those gaps that Medicare after the deductible of $256 this year. So.
And that's why we ask these questions, because it sounds so complicated. There's so many letters involved and numbers, so we want to break it all down for everyone. And again, these videos that you're watching, if you're watching this right now, they're pre-recorded. So at the time of this recording, there's a possibility that the government could reopen. If it remains closed, will that hurt the enrollment process, Carol?
Well, under the Medicare enrollment process, right now, from October 15th to December 7th, we're in what's called the annual election period. And that's when you elect a new drug plan or a new Medicare Advantage plan. You can get off your original Medicare, go on to an Advantage plan. This is the only time you can do that. In January, February, March, we have the Medicare Advantage open enrollment. So you have another opportunity. We use that sometimes when a doctor's group leaves a network, and maybe it's not known to my clients, and we can change them one more time in those first 90 days. But these are all essential workers that are at Medicare and at Social Security, so we have not been affected, and we will not be affected by the shutdown or the lack of it. So Medicare keeps going, our enrollment period keeps going, and the monies with Medicare are set way in advance, so we're not affected by that right now.
That's good to know. Hopefully people will not be afraid of that.
Yeah, don't be afraid of that.
Exactly.
You mentioned earlier about signing up maybe while you're still working, and this is where I made the mistake for my mom. She was working when she became eligible at 65, and I'm like, oh, she's working. She's working with a smaller employer. She doesn't need Medicare. She has her own insurance through employment. But you are required to sign up for A and B at that time.
Is it 3 months before she turned 65?
I think she was already 65.
Well, here's how it works. That was a good question. The enrollment period for you at Medicare, your initial election period, it's called IEP, is the 3 months before, the month of your 65th birthday, and then the 3 months after. But let's go back to that employer question, because I get questions all the time. And they said, she said, he said, Facebook said, my cousin said, and they're usually wrong. I'm just going to tell you, they're usually wrong because somebody heard something somewhere about something. And if you are working at a job with a large employer and it's defined by 20 or more people on the health plan, so that's considered a large employer, you do not need Medicare A and B. You can get A, it doesn't matter, but B, if you enroll in B, you're wasting your money because Medicare B, your employer coverage is primary. And so if you're in a small employer, your employer is secondary. So you have to have A and B. Now, the penalties that are assessed, they're assessed not only for B, as in boy, but D as in drugs. So you get that penalty all throughout your life. It is a monthly penalty that goes with you until the day you leave Medicare, which is normally when we leave this world. But one thing to remember, too, is that those penalties can be avoided by knowing the proper time and knowing when to enroll And it is on, again, I'm going to go back to the Medicare site, www.medicare.gov. It is on there. If you search inside the medicare.gov site, you'll say working past 65, and it will go through all of those. So I have people that right now that are turning 69, 70, and they're just leaving their employer coverage, and then we go ahead and enroll them on Social Security. They get enrolled with their Social Security because Social Security is the keeper of all of our records, and they're tasked with a couple administrative tasks by Medicare. And they tell Medicare, which is our federal insurance, whether you've worked the 40 quarters, you've worked your 10 years, do you get premium-free A? And then they also, in conjunction with the IRS, they tell you whether or not you're going to have an additional charge if you're a higher income earner.
That's a good segue to our next question, Jose.
Mhm.
You, Carol, you touched a little bit about the website a couple times throughout the stream. Is that website actually easy to use? Because I know the individuals signing up for Medicare may have trouble handling the internet or the websites. Is that specific website a good website for everyone to use, user-friendly?
It really is. What they've done is they had a major change in 2019. That's when all the Part D drug plans started feeding the information in. But unfortunately, we had a pandemic, and we had a lot of things that were on our minds rather than a government website. Mm-hmm. And so they didn't get a chance to do the big hoopla and hoorah on it. But it really is, all your data's in there. You create an account. You can search within it. Used to, we had to search without it. I mean, outside of it, you had to go to a search engine and put in a term, and then it would take you to exactly where it was on that monster website. But it's real easy. Everything is on that front page. There's a bunch of tiles. You have to scroll down just a little, and it'll tell you all these information on the very front page of Medicare.gov.
And every year, Medicare sends you this thick book like
Yes.
that.
Yes.
This thick book.
All the plans, and that is overwhelming. But now you can just go to this website, and voila.
Get started, log in or create an account.
Yep.
Wow. It does look very user-friendly.
Now you can do it. Go back up to the top. Go back up right there. Whoop, no, go down. Get below the guy. Right there where it says find health and drug plans. You can do it as a guest.
Oh, wow.
You can go in there and look. See, it's going to ask you some questions. Put your zip code in.
I don't know the zip code.
78722. Put one in.
78722.
There you go. And then continue. And it's going to ask you, what do you want to look for? Look for Part D. See, Medicare Part D. Find plans. It's going to ask you some questions. If you qualify, just so I don't get any of these, go to the last bubble.
Not sure?
Not sure. Yeah.
This one.
Either one.
Okay.
Not sure.
Oh.
Yep, there we go. And then yes, you want to see the drug cost. And see, you've already done it. You've already helped somebody. Right here, you would put the drug in. You know, you could put any drug in there. And you would then add the drug. And you can go through and add all the drugs. Now, you can do it as a guest, but let me tell you, if you're doing it for someone that you love or someone that you're helping or yourself, you log in and your medications are there. And it will show you, go to that same site, find health and drug plans, and then it's going to show you on the scroll down to the bottom, it'll say edit your pharmacies and edit your drug list. And you don't want to put on there the antibiotic that you took or the cream that you only used because you had something on your arm, but you would only put those that you take on a regular basis. And then it tells you, it tells you what the next plan is going to be. It tells you what it's going to cost. It tells you what pharmacy is the best price. I always say just because you love H-E-B, we all love H-E-B, but put in Walgreens and CVS because Walgreens will sometimes have a better price. Mm-hmm. So try to go over there. But H-E-B's been really good about contract prices. I've been pleased with H-E-B on the pharmacy side for about 3 years.
Yeah, H-E-B is my pharmacy too.
Yeah.
Gotta love your H-E-B. Our next question kind of touches on Jose's question about the mistake he made with his mom. Are there some mistakes people should be aware of or keep an eye out for not doing when applying for this?
Yeah, you really want to be aware of when you need to apply for Part B. And I'll go back to the employer side. But some people just they're very healthy and they're not very sick. And they say, well, I'm not sick. Why should I buy insurance? And that Part B at $185, they're thinking, I have hospital insurance. It'll protect me from a very large expense. But it doesn't. because the hospital also has anesthesiologists and surgeons. And if it's not an emergency, you have to hire an anesthesiologist and a surgeon to replace your knee or to do any kind of surgery. So that comes under Part B. The hospital is literally the hospital bed and those doctors that work at the hospital, and that's in an emergency. So that's the one mistake, is that not enrolling when you're supposed to, and that is the 3 months. You have 3 months after the month you turn 65. On that third month, that last day of the month, you are in penalty phase after that. If you're not working or you're working for a small employer, you enter into that penalty phase. And the other mistake people make is they just ride along, burying their head in the sand and don't make any changes. And they get to their Part D drug plan, and there is a document called the Annual Notice of Change. It's by law, has to come to you. If you signed up for paperless, don't forget, it's in your portal or in your inbox with those 7 jokes. It's under there somewhere hidden. So go to the Annual Notice of Change, and it tells you, and a couple years ago when the Inflation Reduction Act came in, we had a plan that was like $12 a month. Well, it went to $60 a month.
Wow.
In 1 year. And so if you didn't see it and you didn't understand that, then the mistake you made was waiting until you went to get your first fill in January, February. Then you call your insurance agent and yell at them. But it's just, it just is everybody's responsibility to take care and understand what their insurance is now. And if it changes every year, which the Medicare Advantage and the Part D change every year, those contracts, and people forget, those contracts are from January 1st to December 31st. So it can change in the next year. It can have a premium or it can go lower. This year we actually had a plan that went a couple dollars lower, but your drug needs to be on there. So that's a mistake they make, not enrolling, not doing the proper timing of the enrollment, and then not checking the plans on the site.
That's a good reminder for people who are already enrolled, and when they have to renew the process again, that's double check those plans.
Yeah, don't forget all the steps. Make sure you're going through it slowly and reading every single part of that web page, or if you're doing it on paper as well.
And you saw how easy it was, Esmeralda, when you did it. It was very easy to just go through, and you can help anybody anywhere across the country. If you have relatives living in other countries and you're very computer savvy, offer your services to your neighbors. You may have elderly neighbors, and you may be able to go and take your laptop and help somebody to get to review what they have. Yeah. Don't play insurance agent. Just go to Medicare.gov.
Yeah.
If you're walking and you see your neighbor, make sure you ask, did you sign up for Medicare? And then if not, help them out, right?
And can I say a word about agents?
Yeah.
Okay, I've been an agent. I've been in the Medicare business for over 20 years. And we are paid by the carriers. No one pays us to work. In fact, it is illegal for me to charge you a fee and sell you a product. So if I want to charge a fee, I have to get out of the sales part. And I could be like a CPA or a lawyer or a consultant. But as long as I'm in as a sales agent and I have my licenses, and we are also certified by the carriers, we have to take a carrier test and we have to take a federal test every single year. So every carrier I sell for, I have to have a certification test every single year. And you have to pass it. You know, it's a 90%. It's not a real easy test. But we have those certifications. They pay us. Insurance is still a commission business, but whether you buy it from someone like me or your local agent or even an agent on the phone, 1-800-CALL-ME, call center, it's the same price. So you're not getting a discount by buying it online. It's not like that. It's the same, because these prices and our commissions are all set by federal statute. So, and the Texas Department of Insurance is the one who regulates insurance companies doing business in our state. We had to remember that the departments of insurance in each state regulate, and their consumer protection for all of us. So you can't have a product, if you're a giant company, you can't come into Texas without going through our Texas Department of Insurance.
That's good to know.
Yeah. Are there people out there who are trying to scam on older adults?
We saw a ton of it right during the pandemic when everyone couldn't get out, they couldn't go, and the call centers, they were bad actors. And there were some rules that came down and kind of put a big burden on our heads too. We weren't call centers, but we were lumped in to be like call centers. But what they'll do is they'll ask you a question and you'll say yes, and they have a yes recorded for you. Or they'll ask you, say, well, I'm with so-and-so company, XYZ insurance company, and they think that person is working for that company, and just that may be their company. but we need to check some information. Well, they get the information, and then they can sign you up for a plan because they already have a yes.
Yeah.
And so it's a little hairy, at times, and I do have to go in and unravel some things. So before you give anybody your information, never give your Medicare number.
Will anyone ever ask for your Medicare number?
Yes, people ask for it. No. Well, do we need to ask for it? No.
Like from
no.
the official government
No.
Employees. They will not ask for that.
CMS and Social Security will never call you unless you have a case going. Social Security may call you if there's an active case going. Maybe it's a lawsuit, maybe it's just your sign up. But Medicare will never call you. And anybody says they're from Medicare, that's not true.
And what are some of the things that they will never ask you over the phone?
Well, one should never give out if someone calls in to you, you should never give out your date of birth, you should never give out your Social Security, or you should never give out your Medicare number. Those are 3 pieces of information that can open a lot of doors that you may not want opened. So if an insurance company is calling you, and that's your insurance company, they have that information. If a nurse contractor is calling you, they already have that information in your file. If they are working for an insurance company, say as a home nurse, they have to have that HIPAA protected information in order to have your file. So they don't need to ask you these questions. And so the moment that somebody starts asking you these questions, just say, let me have a phone number, I'll call you back. And if they're legitimate, they will give you a phone number and tell you they're working with XYZ insurance company, and then you'll be able to call them back. But it's kind of like a bank calls you. Is that your bank? Did they send you a text? Did the toll authority send you a text? No, but yet it looks real. So don't give that information. Know who you're talking to and be able to call them. You call your insurance company.
And oftentimes now with things like AI, sometimes they do send you a text and it looks real, but it really isn't. So it's important to know some of the key signs that can tell you if something is fake or not. And if your neighbor, your grandparents don't know that, help them out, because it's kind of hard to remember all the things to avoid scams.
Right. Just if you're at the website, the Social Security website is ssa.gov. Medicare is medicare.gov. Those are government sites. So
Email address all end in .gov too.
They do. And again, the only time you're ever going to get an email from any of those entities is if you are either in process of enrollment, but they will not just randomly send you a request for information. It doesn't happen. They may send you some information, but a request for information will not come via text.
That's good to know.
I always tell my mom, before you delete suspicious text, to show it to me first, just to
make sure. Yeah, because sometimes you may be deleting a real text message, and then you'll get stuck with deadlines that you missed and stuff like that. So just double check, right?
So any advice for maybe somebody out there who might be feeling a little bit overwhelmed about the process? What would you say to them?
Well, sometimes if you've been to an event at some of the senior centers, during this period of time, there's agents all over. And if you call into some of the major carriers, United Healthcare is one, they may have agents that are having events. They might be at a senior center, they might be at a rec center, but there are agents around town during this period of time. There are also the Area Agency on Aging. Every county in the United States has an Area Agency on Aging that represents them. They have navigators that will do this. They're not paid by the insurance companies. They have volunteers and paid staff that will help you navigate these things. But every single county is covered under that. So that's a good way. Medicare.gov has a chat feature, a fabulous chat feature. If you call 1-800-MEDICARE, you'll get somebody, but you might wait for an hour or an hour and a half. You can talk to somebody during this enrollment period. Now, it doesn't happen other times of the year, but the chat feature is really good. You don't have to wait. And if you're logged into your account, you have a chat going on. If you're not logged into an account, you can log in as a guest. But I will often chat with my clients on that feature. So I know it's a very good feature. And as an agent, I've actually chatted and asked a very specific question. Normally they don't know, but they'll know where to find it, and they'll go find it. But the chat feature is a good all year round feature for that site.
Well, the resources that Carol mentioned, we have those with this story for people to check out. On our
website, KXAN.com. Jose wrote a wonderful story on this topic, and you can find the links to the resources on all of that good stuff here on our website, right?
Yeah. And I love the headline, everything you need to know before December 7th, because that's the
Hopefully
deadline.
that catches your eye.
So just speaking of December 7th, there is one more deadline. If you got a letter, you did not get an annual notice of change, you got a termination letter. And if your company is terminating a plan, maybe they're just terminating one plan out of 10, but you get a termination letter, you do have a little extra time. If your plan is terminating, they give you till the end of the year.
That's good
But
to
it
know.
has to be a terminating plan, yeah.
That is good to know.
Yeah.
Well, this is not the only time that people can enroll for Medicare. Is there any other times of year?
Oh, there's tons. If you move out of the service area, if you move from one part of Texas to the other part of Texas, or you move from California to here, different. If your plan is not offered in this area, then you get an enrollment period with the move. If there's a weather disaster, and even if you're not affected by the weather disaster, but somebody that helps you, such as Jose, if you lived in another area were affected by a disaster, your mother would be able to take advantage of that because you weren't there to help her during her enrollment period. The change, if a government, there is a list, there's about 19, there's a lot of things that will put a person into what we call an SEP or special enrollment period. But move is a big one. Plan termination is another one. The weather disaster is one that has affected a lot of people, especially along the coast, or if a big tornado comes through, and that's
fire,
a fire, if a fire during this period of time, any natural, when the governor declares a disaster area, it opens an enrollment period.
That's great to know. Yeah.
Or if you leave employer coverage, that's another one, the big one. So you're 69 years old and you've left your employer coverage, you open up a whole enrollment period and you have all these rules of when you can get a plan.
So if anything comes up, anything that you think may possibly be a reason to get an extended enrollment period, just search it on the website, right? It should tell you there.
Search Medicare.gov or call them. If it's off outside the enrollment period, you can call Medicare and get right through.
Well, thank you so much. I think these are all the questions that I have. Jose, was there anything else you wanted to ask before we wrap up?
No, I think this is very helpful. I think even for me, for somebody who has to go through the renewing process, very helpful. Thank you so much, Carol.
You're very welcome. Thanks for helping spread the good words.
Yeah, thanks for joining us here on KXAN Plus. Jose, that's all we have for today. Thanks for joining me as well, too. And we will see you next week with another stream. Thank you.